So here we are with a new connection, and we're talking with Elyse Wheeler. She's a PhD. She's an associate professor at the Albany College of Pharmacy and Health Sciences, because we're talking about the health sciences today.
We are indeed, and Ann, you've been so good to us the last several years for me to come on and talk about the field of diagnostic laboratory sciences, which is a field I've been in for over 30 years and still are very excited about. We are moving into a new era in that because we have new students. We have new kinds of students. We have students who are very astute about their technology. They have their iPads
smarter,
and their iPhones and all of these things. And we are fortunate that the state of New York has entered into an agreement with the Clinton Foundation through the American Society of Clinical Pathology, which is our national organization of physicians and laboratory diagnosticians, to start a program in the state of New York to try to improve the number of individuals who go into the workforce, who go into the laboratory field. As I've told you years past, and it's not gotten any better, there's a critical shortage of these folks in the laboratories.
So you're going to get a job.
So you're going to absolutely get a job, and the salaries have been climbing the last couple of years.
Right.
So the salaries are much better than they were. So the Clinton Foundation has donated money through the ASCP, American Society of Clinical Pathology, for New York State to have 4 initiatives. One of them is to build a network of all the hospitals that allow us to train our students in the hospital, because we do it in the laboratory and the classroom at the college.
You need the professional experience
program. And then
program.
you have to have the professional experience, because New York State is now a licensure state, and you have to have 720 hours of experience before you can get your license.
Yeah, in the field.
But
so
you can't work in a hospital laboratory without that license.
Right.
And so that's critical.
Very important for that. And as we see medicine evolving, it's not just I'll hold your hand and talk to you. There's tests that go on. It makes the diagnostics and treatment much more accurate.
More accurate, and also gives a better prognosis for the patient. The national statistic right now is that 80 to 85% of the new diagnoses made in a physician's office depends on a laboratory test. Mm-hmm. Now, it's either a test to confirm what the physician is thinking, or it's a test result that allows him or her to go down the right road.
Or a differential diagnosis.
And as we are looking at the human gene, the human genome,
we're
able to customize the treatments for patients based on those molecular tests.
And you have a research facility that is working on that.
We have the Pharmaceutical Research Institute is very active in working on pharmacogenomics, the ability to customize the medication that goes to a patient for a specific disease state. One of the exciting parts of this initiative, though, is the ability to create simulation experiences for the students.
Oh, nice.
Now, Disney has had simulations at all of their parks. We play simulated games on the video game systems, which these young people have grown up with. And the military
leaving us behind sometimes.
Exactly. The military has trained individuals using simulations for many, many years. And the instruments that are in these laboratories are tens of thousands of dollars to buy, and so a college can't afford to do that. Even the big SUNY systems can't afford to have all of the instruments to train the students. These simulations will allow us to train them on these instruments, on how to make the right choices, how to troubleshoot. And at the same time, it's fun for them because they really enjoy this kind of technology being presented.
It's a new way of teaching.
Absolutely, and that's been a challenge too for some of those of us who've been in the field for so long, is to keep up with that technology. And that's where the shortage is coming from. Many, many of the laboratory professionals out there are in their upper 50s, and we're starting to retire, and we need this new generation coming on board.
If someone went through this program and was looking for a job, would they be working in a hospital? Would they be working in a special laboratory facility? Where would you find these jobs? In a research facility? Where would they find?
All of the above.
Okay.
The majority do go into hospital laboratories. There are reference laboratories, which are laboratories that are private, like LabCorp of America and Quest Diagnostics. Many people go and get their blood drawn at the drawing sites. But those laboratories do a lot of the work that hospital laboratories cannot afford to do because it's low volume in a single hospital. So there's reference labs, hospital labs. Many of our techs our graduates go on into research with pharmaceutical industry, as well as in medical instrumentation, coming up with the new generations of these instruments that turn out the results faster. And the outcome of a quick result is the patient gets treated sooner.
Quicker and more efficiently.
And on the opposite side of that, this shortage is impacting how quickly you can get your result back. And that means that you're waiting for the physician to treat you.
I know. I mean, if you've ever had a lab test, you know, they've drawn something or done a biopsy, you're saying, okay, when can I get the results of that? And they go,
Right.
well, maybe in about 10 days. It's like, no, I want to know
You want to know now.
And I'm sure the physician does too, but without the personnel and the people that can actually run those tests, it's not going to happen quite as quickly.
It just takes
now,
longer.
who does, when you go in for surgery and they take a biopsy and they don't close you up until they find out whether that is cancer or not, is that the people that you train do that too?
That's one of the category of people. Histotechnology is one of the fields where you deal with the material that comes from a surgical site. And so the histotechnician or technologist, and the difference, of course, is an associate's degree versus a bachelor's degree, will be there in the surgery suite. They will prep the specimen for the pathologist, and the pathologist will read it right there in the surgery suite and tell the surgeon whether to close the patient or whether they need to take a little more tissue, particularly if you're trying to deal with a cancer.
Right.
But if the pathologist says they've gotten the right specimen, then the rest goes upstairs, and the histotechnologist processes that specimen, makes these very thin slides for the pathologist to interpret, and does all of the special staining that can be done. Then you've got your cytotechnologist, and we have a program at the college in cytotechnology. It's a master's program, and they read your pap smears, and they look at all of the other types of specimens, like if you have a breast lump and they do a fine needle aspirate. The cytotechnologist reviews those and then works in concert with the pathologist to make a diagnosis. And then the other side is the clinical lab, which is where they do all of your blood glucose, your lipid profiles. They look at your CPK enzymes. If you come in with chest pains, they think you may be having a heart attack.
Calcium,
they check your calcium. They look and see if you're anemic. They do all of the over 1,200 different types of testing.
I know if you ever had a blood test, a CBC, I mean, it's like
it gives you all that information.
All that information.
And we help the physicians to interpret it as well as to know what test to do next if the diagnosis is not real clear.
Now, we're talking laboratories. What about forensics? Do you touch on that, or do they go to a special school for that?
There are special programs for forensics. SUNY Albany has a very good program in forensic toxicology and forensic chemistry. Everything that we train the students to do in the clinical laboratory is the same thing they do in the forensics laboratories.
Okay. That's what I
The difference is chain of custody.
Yeah.
The difference is documenting everyone that has touched that specimen so that when it goes to court, they can say with definity, these were the specimens that were brought to us. Now, we don't do blood spatter, we don't go to the crime scene, and we don't wear stiletto heels and have mood lighting. No, unfortunately not.
Doggone it.
But at the same time.
See, all these people out there that want to go into it so they can wear stiletto heels and have that low lighting,
Exactly. I think it would be great if we could do that. I'd love to look like those people too. But at the same time, we do prepare them well to go on into master's programs where they can get the forensics training if they want to work at the State Forensics Lab or other forensics facilities. But we have interesting things. Many of our graduates have gone on to physician assistant programs as well. I have 5 students currently at Albany Med's PA program, and they're doing very, very well. It's a good preparation, not just to have an excellent career, but to go on for additional training.
And it's good, too, if you're in a stagnant field that you're in, maybe the field is kind of drying up a little bit. You might want to check your credentials, go talk to the registrar at the College of Pharmacy, or any other college, too. I mean, we want to make sure that there's a lot of options, but we'd love you to go over to the Albany College. And we had pictures. Did we show the pictures, Greg? Greg? Yeah. Okay, good. I just want to show this real quick.
It is a very good transition.
You have a summer program, I do want to mention that.
Exactly.
And that's a summer camp for kids. And this is your Vermont campus, I believe.
Yes. The Vermont campus currently is our 4-year PharmD program.
Okay.
It's for students who already have a bachelor's degree and wish to pursue the PharmD degree. We also have some pharmaceutical science folks up there that are doing some excellent research.
And you can combine your degree with law. I mean, they've got so many programs. Thank you for being here today.
Thank you so much,
and telling our viewers, because sometimes this isn't a forgotten field that we need to kind of get it to the forefront so people know that they can do it. So if you have a biology degree or other degree, check out and see if you can't, pump it up a little.
Come see us. We have a number of programs now.
We got something for you, right?
Thank you.
Good.